It's also important to remember, and I can't stress this enough, that as long as there is no vaccine, we're going to have to be talking about how to do this in a way that makes the most sense and can be done most safely across all sectors of our economy. Going forward, we'll plan to continue to ramp up testing. This will be something we'll probably be talking about for months to come. We'll continue to invest in our contact tracing program so that we'll be in a position to identify people who have in fact tested positive and to contact their close contacts so that we can then do the work that we need to do to help those folks isolate and to support them in their isolation. This will be a fundamental way for us to both contain the disease and slow the spread, and we'll continue to work very closely with our healthcare providers to monitor and prepare for any kinds of change in our surveillance activities. But the threat of future transmission and illness is and will continue to be with us for a very long time, and we should not forget that. That's exactly why we issued our face covering order last week, and I just want to say once again, with respect to that order, the main purpose behind a face covering, if you are not able to physically distance yourself 6 feet or more from the people you're around, is to protect them from you as much as it is to protect you from them. I can't stress enough that one of the major issues associated with this particular virus, while it is brutal and in some cases lethal for certain parts of our population, it has now been documented that a very significant portion of the people who actually contract this virus will never show symptoms at all. And because of that, because such a large number of people who are in fact carriers and therefore contagious can transmit this virus to others without knowing that they're doing it because they show no signs and symptoms that they have it, that face covering is as much about protecting other people from you as it is about protecting you from other people. And I can't stress that one enough. Right now, we're going to continue to do everything we can to continue to stop the spread, follow the data with respect to what it tells us about what we can do with regard to reopening when the time gets there, and make sure that we do this in a correct, planned, and appropriate way. Now I want to turn the podium over to the Lieutenant Governor.